I'm joined now by, keep going, Senator Maria Cantwell of Washington State. Senator, your view about this. I just asked the congressman, I have a sense that the Republicans are afraid of a straight up and down vote on repeal.
Well, you know, it may be that the House overcalculated. Paul Ryan put on the table not only just repealing the expansion of Medicaid that was part of the Affordable Care Act, he went further. He tried to cut Medicaid. So you have a lot of senators who represent entire states, not just a congressional district. They talk to their governors, and those governors in Republican states were like, no, this is a bad idea.
Let me ask you about, now that the air is clear, I do think this fight's over. You're the expert. You're in the Senate chamber. If it's over, if the Republican attempt is like, this is Gettysburg, they weren't able to win this battle. If that's the case, what's the political responsibility of the Democratic members of the Senate and the House to fix what's needed to be fixed in Obamacare? You take the initiative or wait for the Republicans to do it? Who takes the initiative?
Oh, no, listen, the issues of how to provide health care to Americans has got to be a constant discussion between all our colleagues. Now, there are moments that I think, just as the House bill came back, that just because of today, that this isn't over. So I know there'll be a push. There's a discussion that McConnell may have a vote anyway. But look, so we have to keep fighting, because we're not going to kick people off of health care as a way to keep costs down. The notion that that's the way to go was the wrong idea, and I think was the fault of this plan. Now let's talk about the individual market. Let's talk about what are the challenges there and try to move forward.
Let me show you something from Franklin Roosevelt back in 1936. I think it's where the Democrats are right now. Let's watch it. It's a good tape, a good piece of film here. Oh, we don't have that yet. I wish I could show it, because basically he's saying the Republicans always come along and say, we can do anything the Democrats can do and it won't cost you anything. Here it is. Let's watch this. It's great. It's FDR.
Let me warn you, and let me warn the nation against the smooth evasion that says, of course we believe these things, but we do not like the way the present administration is doing them. Just turn them over to us. We will do all of them. We will do more of them. We will do them better. And most important of all, the doing of them will not cost anybody anything.
I mean, Senator, he's being sarcastic there, FDR, but I think we hear the resonance of that today. The Republicans saying, we'll give you health care, it just won't cost anything. It's not going to bother anybody, no regulations, no taxes, nothing. A big fat freebie from the GOP, and now they've been caught not able to deliver.
Well, I know this. My mom, who's an FDR Democrat, would be very proud of that clip and would agree with you. I think that's what made her a Democrat, that somebody said, look, you're not giving access to either, you know, a job or to make the economy work, and here's what we have to do. And she appreciated that. And I think now what we have to do is say there are things that are working in the Affordable Care Act. The expansion of Medicaid has driven downward pressures on the private insurance market price. Okay, so that's worked. We've changed the delivery system and made some improvements, so patients are put at the front of the system and try to control costs that way. So let's talk about what's working, and then let's discuss what's not. But the notion that you're going to get to the what's not by cutting off millions of Americans off of Medicaid, I think there's a lot of senators who just thought that was the wrong approach.
Thank you so much. You're Senator Maria Cantwell of Washington State.